Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.
Gone through the printing process for almost a week now. We'll be ready today. Wondering if the presentation itself does require multiple printouts that can take the whole day or a number of days to prepare. Isn't it possible for the Honorable Minister even to read from his tablet and present to this House? Just read from his tablet in a digital era. We don't have to go to print. Just read from his tablet, present to this House. Isn't that a possibility, right, Honorable Speaker? It's a request to the Honorable Leader that just bring them on a tablet like you do sometimes when you're answering to or responding to questions. Read them from your tablet or from your phone. We're in a digital era than us to have to wait for printing. I submit.
Yeah, Whip, you know, when there's a document, the procedures are that it should be circulated to members. And the responsible minister will come and make a presentation. So, as the leader said, hold your breaths, patience. The tip that you can take from this is that you have been taken care of. That's why you can see me smiling today. So I think it's a promise that the leader has undertaken, and we hope that by health break he'll be making follow-ups on that, so that it is brought and all members have a copy of that report, of the guidelines. Thank you, Whip. And now, honourable members, we have a motion. The motion is to vary today's order paper in order for us to tackle committee reports. I now put the question. Those of that opinion say aye. Those of the contrary view say no. The ayes have it and the motion is carried.
General business, item 2D, presentation of committee reports. Report of the Parliamentary Committee on Health on the committee's activities held within the month of March 2026 in the 2025-2026 financial year.
Thank you. The chairman for Health Committee.
Mr. Speaker, sir, I beg to present the paper standing on my name under item 2D1 of the order paper. I beg to present.
Thank you. Sergeant at Arms. Thank you. Chairperson, would you like to speak to the report?
Yes, right, Honorable Speaker, sir.
Please proceed.
Thank you, Mr. Speaker, sir, and good morning. Mr. Speaker, sir, Tanzania and Kenya have an exciting story on how innovative public-private partnerships have helped them reduce huge expenditure on external referrals. It is a captivating story worth learning from, the story that does not only promote medical tourism, but also inspires their country's economic growth. Mr. Speaker, sir, Tanzania and Kenya have made a remarkable progress in advancing specialized medical care through strategic private-public partnerships. Over the past 5 years, both countries have invested heavily in developing local capacity for complex medical procedures, greatly reducing the reliance on external referrals. This approach, Mr. Speaker, sir, has not only saved billions of shillings, with Tanzania saving approximately 200 million and Kenya around $300 million over a 5 years period, but has also stimulated growth in medical tourism. By expanding access to high-quality specialized treatments domestically, Tanzania and Kenya are enhancing healthcare outcomes, fostering economic growth, and positioning themselves as regional hubs for medical excellence. This exemplary mode of collaboration underscores the transformative impact of innovative partnerships in ensuring accessible, affordable, and world-class health care. This is why, Mr. Speaker, sir, the son of the soil, Dr. Thompson Mpinganjira, is championing transformative ideas aimed at improving the lives of ordinary Malawians. Amongst his most impactful visions is the establishment of the International Blantyre Cancer Center in Blantyre, a bold step towards redefining specialized healthcare delivery in Malawi. Mr. Speaker, sir, the International Blantyre Cancer Center is an exceptional and excellent story. The story that, if adopted and accepted by all of us here, will greatly improve the specialized healthcare services in Malawi. But, Mr. Speaker, sir, allow me to paint a picture on health sector budget outbound expenditure on referral cases for the past 5 years for this August House to understand the International Blantyre Cancer Center story. The Ministry of Health and Sanitation spends about $2 million approximately over 2 billion Malawi kwacha annually on international patients referrals, with over 400 patients on the waiting list for treatment abroad. Most referrals are for specialized cases such as cancer and other complex cases. This figure is confirmed in budget cash flows and health financing reports, which highlight referrals as a major fiscal pressure. For instance, Mr. Speaker, sir, in the 2024-2025 fiscal year, this House approved 1.4 billion, but ended up spending 2.1 billion Malawi kwacha. This costs represent a significant drain on health budget and foreign exchange reserves. As a matter of fact, the external referral expenditure compromises equity, as only a small fraction of patients, mostly politicians, benefit from referrals, leaving many untreated. This is why the IBCC came into being. Mr. Speaker, sir, the International Blantyre Cancer Center has positioned itself as a flagship institution in Malawi's fight against the specialized health care services. It treats approximately 40 patients daily, offering Center of Excellence services in screening, diagnosis, and treatment. The facility provides advanced diagnostic imaging, including CT scans, MRI, ultrasounds, X-ray imaging, and mammography, the latter being the only service of its kind in Malawi. Mammography is critical for early detection of breast cancer. The IBCC, Mr. Speaker, sir, has invested highly in qualified Malawian personnel, oncologists, medical physicians, radiologists, medical physicians, laboratory technicians, and nurses. This multidisciplinary team ensures comprehensive care administration to its patients. Mr. Speaker, sir, the facility is not leaving anything to chance. It is the Center of Excellence, hence the facility lives to its standards. It is for this reason, Mr. Speaker, sir, the facility maintains a robust 3-month scheduled maintenance plan supported by both local engineers and international partners, with spare parts imported in advance to guarantee uninterrupted service delivery. Opening its doors a year ago, IBCC has become a hub for medical tourism. Approximately 30% of its patients come from Mozambique, with others from Zimbabwe and Zambia. This inflow of regional patients, Mr. Speaker, sir, has contributed to Malawi's reputation as a provider of specialized health care within SADC region. And to accommodate this demand, IBCC is constructing a 20-bed lodging facility, a 200-bed lodging facility within its compound due for completion in 6 months, ensuring that patients requiring prolonged treatment have access to safe and convenient accommodation. Mr. Speaker, sir, IBCC offers flexible payment options including cash, MAZIM, individual health insurance schemes, and corporate medical schemes, thereby broadening access to its service. Mr. Speaker, sir, despite these achievements, your committee observed that the absence of enforceable service level agreements, SLAs, and Memorandum of Understanding, MOU, exposes the center to risks of service interruptions and inequitable access. Mr. Speaker, sir, while IBCC infrastructure is exemplary, its long-term access depends on signing SLA with the Malawi government and other partners. The SLAs, Mr. Speaker, sir, will not only improve equitable access of the specialized medical care, but it will also help save billions of kwacha's Ministry of Health spent on external referrals. MOU frameworks into its governance, these instruments are essential to guarantee that vendors, service level providers, and institutional partners deliver services in accordance with agreed standards. They provide measurable benchmarks for equipment, uptime, diagnostic turnaround, and specialist availability, patients' communication, and equitable access. Mr. Speaker, sir, your committee suggests that the specialized healthcare services such as radiotherapy, chemotherapy support, and follow-up care must be formally integrated into SLA. Diagnostic services include MRI, CT scans, mammography, ultrasounds, pathology, and histopathology will help create performance indicators. Future services envisaged under the SLA, Mr. Speaker, sir, include PET, CT, dialysis, surgical oncology, ophthalmology, and expanded inpatient facilities at the center. Mr. Speaker, sir, without enforceable agreements, referral pathways, reimbursement mechanisms, and monitoring frameworks remain vulnerable. PMRA. Mr. Speaker, sir, Pharmacy and Medicines Regulatory Authority has made significant strides since its establishment under the PMRA Act number 9 of 2019. Over 2,000 pharmaceutical products have been authorized for segregation and 129 manufacturers licensed. Regular inspections are conducted to ensure safety, efficacy, and the quality of medicines. Mr. Speaker, sir, PMRA has initiated efforts to integrate traditional medicines into formal healthcare system, recognizing their widespread use among Malawians. The authority, Mr. Speaker, sir, has undertaken a functional review to strengthen its institutional capacity. Preliminary work has been completed for the construction of a national medicines quality control laboratory in Lilongwe. This laboratory, once operational, Mr. Speaker, sir, will serve as a national and regional reference facility, supporting the growth of the pharmaceutical industry, facilitating the integration of allied substances, and contributing to revenue generation. Nevertheless, Mr. Speaker, sir, your committee observed that despite these achievements, PMRA faces serious challenges. Delays in gazetting subsidiary regulations have constrained full operationalization of the PMRA Act, limiting regulation of allied substances such as medical devices, cosmetics, and food supplements. Malawi has not yet attained World Health Organization Maturity Level 3, undermining international recognition of our regulatory system. It is disheartening, Mr. Speaker, sir, to note that a PMRA is not stationed at ports of entry, relying instead on delegated arrangements with the Malawi Revenue Authority. This has created enforcement gaps, allowing substandard and falsified medicines to enter the country. Concerns have been raised about the prevalence of falsified and substandard medicines, which is a major public health threat. Mr. Speaker, sir, allow me to inform this august House that falsified and substandard drugs contribute significantly to antimicrobial resistance. In Malawi, Mr. Speaker, sir, MR is a significant health crisis, causing approximately 3,900 direct deaths annually, with over 15,000 total deaths linked to resistant infections each year. Central Medical Stores Trust. Mr. Speaker, sir, Central Medical Stores Trust remains the backbone of medical supply distribution in Malawi. In the southern region, the trust produces morphine sulfate and methylated spirit and uses electronic systems for product location. To enhance security, the trust installed CCTV cameras, and it uses insulated boxes to transport medicines to hard-to-reach areas. Nevertheless, Mr. Speaker, sir, the committee observed that the Blantyre warehouse is outdated, having been inaugurated in 1968. It operates with only 33 staff and 3 distribution trucks, which are insufficient for the scale of operations. Ox carts are still used in hard-to-reach areas, compromising drug quality. Their warehouse walls are in poor conditions, creating an unhygienic environment. Fire safety protocols require upgrading, and the absence of digital tracking systems exposes medical supplies to theft and falsification. Mr. Speaker, sir, the absence of a modern warehouse compromises the medical supply distribution. Without urgent intervention, such as construction of 8 billion warehouse, the reliability of medical supply distribution will remain compromised. Not only that, the limited fleet constraints responsiveness and delays deliveries and undermines the reliability of supply to district health offices and central hospitals. Recommendations. Mr. Speaker, sir, to address these challenges, the committee recommends the following. IBCC, that the Minister of Health and Sanitation sign service level agreement with International Blantyre Business Cancer Center, covering all specialized healthcare services such as oncology, diagnostic imaging, mammography, histopathology, and laboratory services, with quarterly compliance reports submitted to Parliament. That the Malawi Revenue Authority, in collaboration with the Ministry of Finance, Economic Planning and Decentralization, facilitate smooth importation and clearance of specialized medical equipment through preferential duty and tax frameworks. 3, that the Public Procurement and Disposal of Assets Authority ensure all vendor contracts embedded SLA clauses and report annually to Parliament on compliance. 4, that the Ministry of Finance, Economic Planning and Decentralization tie financing approvals and subsidies to demonstrated compliance with SLA commitments and ensure subsidy provisions for low-income patients are transparently reported to Parliament. 5, that the National Cancer Center Control Program, in collaboration with the Ministry of Health and Sanitation, integrate SLA monitoring into its oversight role, publishing performance metrics and submitting annual reports to Parliament. 6, that the Ministry of Health and Sanitation, in collaboration with IBCC, develop and implement standardized performance indicators to monitor service efficiency, patients' outcomes, and clinical quality, with quarterly reviews submitted to Parliament. PMRA, that the Ministry of Justice and Constitutional Affairs, in collaboration with the Ministry of Health and Sanitation, expedite the gazettement of outstanding regulations under the PMRA Act 2019 and submit to Parliament a clear implementation timeline. 2, that the Ministry of Health and Sanitation, through PMRA, develop and implement a time-bound roadmap towards attaining WHO maturity level 3. 3, that the Department of Human Resource Management and Development, working with the Ministry of Health and Sanitation and the PMRA board, undertake a targeted review of PMRA's organizational structure benchmarked against regional authorities. 4, that the Ministry of Industrialization, Business, Trade and Tourism, in collaboration with the Malawi Revenue Authority and the PMRA, review the coordinated border management framework to facilitate deployment of PMRA personnel at ports of entry. 5, that the Ministry of Health and Sanitation, through PMRA, strengthen post-market surveillance systems and develop a coordinated risk communication strategy. 6, that the Ministry of Information, Communication and Technology, in collaboration with MACRA and the Ministry of Health and Sanitation, establish and enforce a comprehensive regulatory framework for advertisements of medicines and allied substances. 7, that the Ministry of Finance and Economic Affairs and Decentralization, in collaboration with the Ministry of Health and Sanitation, mobilize financial resources for the construction of National Medicines Quality Control Laboratory in Lilongwe. 8, that the Ministry of Trade, in collaboration with the Ministry of Health and Sanitation and Investment Promotion Agencies, develop targeted policy interventions to promote local pharmaceutical manufacturing. 9, that the Ministry of Health and Sanitation, through PMRA, expedite frameworks for the regulation and integration of allied substances, including traditional medicines. In conclusion, Mr. Speaker, sir, strengthening institutions such as IBCC and other health facilities through a well-structured public-private partnership model and signing of SRA present a practical and sustainable pathway towards transforming the specialized healthcare system in Malawi. By leveraging private sector efficiency, innovation, and capital alongside public sector oversight and equity goals, the IBCC, for example, has demonstrated its capacity to deliver specialized medical care locally. The PPP model does not only improve timely access to affordable, high-quality care for patients, but also significantly reduces the need for costly external referrals. In doing so, Mr. Speaker, sir, the country stands to save billions of kwachas that can be reinvested into further strengthening the health system, workforce development, and infrastructure expansion. Mr. Speaker, sir, the strategic investment in Central Medical Stores Trust, for example, is critical in addressing the growing threat of antimicrobial resistance. By ensuring consistent availability of quality-assured medicines, improving supply chain management, and reducing stockouts that often lead to misuse or substandard alternatives, Central Medical Stores Trust can play a central role in promoting rational drug use. This, Mr. Speaker, sir, will help curb the rise of resistant infections and ultimately reduce antimicrobial resistant-related mortality. Strengthening Central Medical Stores Trust is therefore not just a supply chain intervention, it is a life-saving investment that safeguards the effectiveness of essential medicines for future generations. With these remarks, Mr. Speaker, sir, I beg to move that the report be considered and adopted by this august House. I beg to move. Thank you very much.
Thank you, Chair. Any committee member to second the report? Mwanza West, you have the floor.
Thank you, Mr. Speaker. Mr. Speaker, sir, I rise this Thursday morning to second the speech ably delivered by the Honorable Chairperson of the Health Committee, and I do so with a deep sense of duty and conviction because the matters contained in this report are not mere administrative observations, but issues that go through the very heart of the well-being, dignity, and survival of Malawians. Mr. Speaker, sir, honorable members of the Parliament, the activities undertaken by the Health Committee in the month of March 2026 were not routine engagements. They were an important exercise in parliamentary oversight over our institutions that are central to the performance, credibility, and resilience of Malawians' health system. These activities allowed your committee to engage directly with institutions that are vital to the health of our nation. Mr. Speaker, we saw the determination of Pharmacy Medicines and Regulatory Authority, PMRA, to strengthen regulation. PMRA is not just an administrative body, it is a public health protection institution. It is the authority entrusted with ensuring that medicines related products that enter our markets are safe, effective, and of acceptable quality. When regulation is weak, counterfeit and substandard medicines find their way into our communities. When border surveillance is weak, unsafe products can easily enter the country. And when enforcement is weak, citizens are left exposed to harmful products that can worsen illness, delay recovery, or even cost lives. Therefore, as Parliament, we must insist that medicine regulation be treated not as a bureaucratic function, but as a frontline health protection service. Mr. Speaker, sir, your committee also had the opportunity to engage with the International Branch Cancer Center, IBCC, an institution that represents an important step forward in the development of specialized healthcare services in Malawi. Cancer is no longer a distant or rare condition in our country. It is increasingly affecting our population, and many families are living with the emotional, social, and economic burden of cancer diagnosis and treatment. The concern here is not whether specialized centers should exist. They absolutely should. The concern is whether such institutions are being developed in a manner that guarantees equity, accountability, continuity, and value for public health. Therefore, as a country, we must not only celebrate infrastructure, but also build systems around that infrastructure to ensure safe delivery is sustained and protected. Mr. Speaker, sir, the visit to the Central Medical Stores Trust was perhaps one of the most practical reminders of how deeply health and safe delivery depends on a functioning supply chain due to its resilience in distributing supplies under difficult circumstances. CMST is the backbone of medicine and health commodity distribution in Malawi. Its performance directly affects whether a health center has antibiotics, whether a maternity ward has oxytocin, whether a district hospital has a laboratory reagents, and whether frontline workers can actually provide the services that government promises to the people. In short, when CMST is functioning well, the public health system is able to breathe. When it is constrained, the effects are felt immediately by the communities across the country. As Parliament, we must continue to demand reforms that will make our nation's medical supply chain more responsive, reliable, and fit for purpose. Mr. Speaker, sir, these engagements reviewed both achievements and challenges, as the Honorable Chairperson already said. What your committee observed in these institutions reflects the broader realities facing the health sector in Malawi today. This is why the report before the House is both timely and important. It reminds us that the strength of our health system depends not only on hospitals and health centers, but also on effectiveness of the institutions that regulate medicine, support specialized treatment, and ensure commodities reach the people. PMRA is registering products, but remains constrained by delayed regulations and weak border presence. IBCC is a beacon of excellence, but yet its sustainability depends on enforcement agreements and oversight. And CMST continues to serve as the backbone supply distribution, but its warehousing and fleet are inadequate to for the demands of modern health care. Mr. Speaker, sir, if PMRA is weak, unsafe and substandard medicines will find their way into our communities. If CMST is undercapacitated, medicines and essential supplies will not reach facilities on time. If centers like IBCC are not properly supported and governed, then our aspirations for specialized care and health system modernization will remain beyond reach. This is why the findings in this report matter greatly. Mr. Speaker and honorable members, the recommendations presented by the chairperson have clearly assigned responsibilities to the relevant stakeholders, ministries, regulatory authorities, and oversight bodies. It is now incumbent upon the Minister of Justice and Constitutional Affairs, the Minister of Health and Sanitation, the Department of Human Resource Management and Development, the Ministry of Industrialization, Business, Trade and Tourism, the Malawi Revenue Authority, MACRA, the Ministry of Finance and Economic Planning and Decentralization, PPDA and National Cancer Center Control Program to act with agency and coordination. Mr. Speaker, sir, by adopting this report, we are not only acknowledging the work done in March 2026, but also committing ourselves to hold these stakeholders accountable for implementation. This is how Parliament ensures that recommendations translate into reforms and reforms into better health outcomes for our citizens. As a committee, we are interested in reports that gather dust. We are interested in reforms that improve service delivery. We are interested in systems that protect lives. We are interested in systems that protect lives. I should repeat on that one. We are interested in institutions that work for the delivery of Malawian citizens. Mr. Speaker, sir, with these few but honest remarks, I beg to second.
Thank you. Thank you, Mwanza West, for seconding the report. Any takers? Debate? I see Sanje Central. Salima Central West. And Doa Mpuzi. In that order, please. Starting with Sanje Central.
Thank you, Mr. Speaker, sir. Mr. Speaker, sir, I thought this is the right time for me, on behalf of the people of Sanje Central, also to stand up and commend the work that Sir Tom Pinganjira is doing to our nation. Sir Tom Pinganjira is not the only very rich person in Malawi. There are others that are so rich. But him decided with his family to support many Malawians by spending their resources constructing this very important facility so that all of us are supported within our country. I'm aware of the fact that as a government, Malawi decided to construct our own cancer centers. But it has taken more than 10 years now. We're still struggling. It only took Sir Tom Pinganjira a few months to construct this very important facility. This individual, Mr. Speaker, sir, needs the recognition of our nation. But, Mr. Speaker, sir, what did we do to this very humble person? We humiliated him. After spending his money supporting our nation, we humiliated him. We should stop such kind of behavior. We should be able to recognize Malawians that are ready to support the nation. This is a person, Mr. Speaker, we should be able to stand up and say the truth. This person spent his life working very hard, and the money that he has. We have people that have looted public resources, are investing in Dubai, are investing in South Africa. But this Malawian decided to invest here in Malawi. And therefore, humiliating him for no good reason was something which we should condemn. Mr. Speaker, sir, it is important that as a country, we should work towards improving our service delivery in our health sector. A week or so ago, there was a patient referral from Likuni Hospital, going to Central Hospital, a lady with complications of intestines. She was referred to Central Hospital for an emergency. Went there at 5 o'clock, never got any support, and was told there are no doctors to look after this lady. This lady, had it not been that their parents, their relatives decided to move this lady out of Central Hospital, probably would have died. She had to be moved from Central Hospital, being taken to Partners for her. And at Partners for Health, people are so compassionate that they were able to operate on this lady without paying a single tambala. But our own health facilities could not provide that service. This is something that all of us should be concerned about. We have a lot of relatives in the villages that are struggling. We need to do something about our health services so that our people are given the necessary support that they deserve. I want to end my contribution, Mr. Speaker, sir, by saying this. Sir Tom Pinganjira at one time provided resources for early screening of cancer to men. This is a rare opportunity that is given to men. There are so many men that die of cancer because they did not get the early screening. And therefore, I want to say thank you, Sir Tom Pinganjira. I'm one of those who took an advantage of that, went to College of Medicine, got screened, and I get advice on what I should be doing to make sure that I don't get cancer. And this should be encouraged, and I wish other Malawians that have resources, that had an opportunity to loot the public resources, get those resources back into Malawi so that Malawians benefit from those. Otherwise, investing in South Africa, buying houses in Santon for only yourself and your family is doing injustice to this country. Mr. Speaker, sir, thank you so much for this opportunity, and the people of Nsanje Central appreciate the work of Sir Tom Pinganjira. Thank you.
Thank you very much, Nsanje Central. Indeed, we should love our country. Malawi should come first. Let's go now to Salima Central West.
Thank you so much, Honorable Speaker, for this opportunity that you have given to people of Salima Central West to comment on the Health Committee's report. Honorable Speaker, today is a joyous day for me because the elements that the health report has touched on are of paramount interest and goodwill to Malawians. I'm saying this because I'm coming from a medical background. I'm coming from a background that I served as a Deputy Minister of Health and also a one-time member of the Health Committee in the last cohort. We lacked such type of boldness that we can tackle issues that can bring a better health to Malawians. The Health Committee has talked about Tanzania and Kenya. That has moved to an element that contributes to medical tourism. Kindly allow me also to add on a country that I had privilege to visit, that is India. They had done a proper study and looked at the disease burden and looked at the elements that used to take away their money externally. Here also in Malawi, people have done that. What we need is an affirmative action. And what is a burden to us, looking at the 2 billion that the committee has talked about that was spent on patients waiting for external referral, it's a lot. And I think this calls for a sobering decision by the nation, including the Minister of Health and the Minister of Finance. It's high time now, Honorable Speaker, we should start thinking of establishing centers of excellence in this country. Centers of excellence in areas that we are spending money on to send people outside this country to access medical care. Let's look at issues related to cardiology, issues related to ophthalmology, issues related to oncology, and also orthopedic. It's good that other partners are coming in, and we've got Leon Center. But that needs sustainability, and we need committed resources, because that began with a family. And that family, one day, will say, Malawi, take over. The question is, how prepared are we as a country to sustain that facility that is there? It's time now that we should look at a facility in Mzuzu, a facility of excellence here in Longwe, in Blantyre, as well as in Zomba. This will be the beginning of medical tourism. If you go to India and check on elements that bring money externally, medical tourism, I think, is on number 4. But they didn't just come on number 4. they began somewhere on investment. They invested in equipment, infrastructure, as well as human resource development. Therefore, bravo to the committee. This is great. I hope the system would listen and respond to this, and we start preparing, put money into it. If we had taken, let's say, that 2 billion that was spent, and began with a certain center of excellence, put in a lot of money there, closer, even though we are still sending, but start reducing. This money will be spent within this country and will do a lot of exploits. Let me also allow me, Mr. Speaker, to comment on PMRA. Great job done by the committee. But let me applaud government, also Minister of Health and PMRA, for the cordial relationship which is there with our colleagues crossing the borders. The issue of the 500 products that were given to us as an array, that they were falsified, came from Kenya and South Africa. It means that between PMRA and our colleagues across the border, there is that effective collaboration. But now the question is, within the past 12 months, how many products has PMRA recorded? Because that is an eye-opener. If we can have that 500 products, out of the 2,000 products that we are told are registered, 500 have been recorded. It is an eye-opener. Probably, Mr. Speaker, it's high time that we should start thinking of capacitating PMRA, especially their laboratory. We told them that it's a fact, that it is still serving at level 1. Our friends that have given us these triggers and alerts are already on level 3. It's high time that we should start now elevating PMRA's laboratory to level 3. There was an attempt by the previous government, Mr. Speaker, that they were allocated land in the city center to construct a modern laboratory. Where is that issue? Probably the Committee on Health and Committee on Lands can jointly work and follow up on this matter. We need that construction. We need an elevation. It's for the safety of Malawians, and it's the safety of us who are living in Malawi. We should elevate that laboratory to a level that can safely detect such type of falsification within this country. The question that I have also, Honorable Speaker, is, has an adverse effect survey done for the 500 products that have been recorded out of the 2,000 that are registered? If these 500 products that have been recorded by South Africa and Tanzania are among the 2,000, then that is a point of concern. What is that is going to be done? And what is it that the ministry has done? Otherwise, we applaud them for the effective participation in those records. Records are not uncommon within the pharmaceutical sectors. They are there. But the concern is when it comes to its associated adverse effects, which should be a concern to us Malawians. Otherwise, it should not raise a panic now, because I know and we're sure that they will be handling it. Honorable Speaker, the committee has talked about Central Medical Stores Trust. Very good observation. But you may recall, Honorable Speaker, that one day I said, Central Medical Stores now may not need recapitalization bailout. They had money. They had that 17 billion from the World Bank support. What we need Minister of Finance and Minister of Health to do is to finance National Local Government Finance Committee and send hospitals to pay back Ngongole. They owe Central Medical Stores a lot of money that these two hospitals need to pay back to Central Medical Stores. That money will keep the life of Central Medical Stores. Otherwise, if they don't, time in, time out, we'll be talking about bailing out Central Medical Stores. Yet, they've got that money. These hospitals owe Central Medical Stores. Central hospitals owe Central Medical Stores. But the bailing out of such comes from now the commitment that the Minister of Health and the Minister of Finance need to do jointly. The question is, are there any efforts to bail out Central Medical Stores through paying the National Local Government Committee that is going to pay to these hospitals? I know there are attempts for direct injection of that money, but probably these hospitals must be responsible. They are the ones who got these products, and they got money. I mean, they got products from Central Medical Stores and accumulated these huge debts. I, therefore, Honorable Speaker, would like to sit down, thanking the Health Committee and applauding them for the good job that they've done, praying that there will be follow-ups on the elements that they have recommended. Thank you so much, Honorable Speaker, sir.
Thank you, Salima Central West. Let's go to MPUNGWE-PUNGWE. MPUNGWE, sorry.
Thank you, Mr. Speaker, for recognizing the people of MPUNGWE to contribute towards the report that our chairman just presented. Indeed, the report highlights critical issues that as a nation, we need to come to a point of recognize what should be prioritized in terms of our health. As they say that a health nation is a productive nation. I would want to first comment on the IBCC visit, the International Blantyre Cancer Center. The visit was such an eye-opener, and from the recommendations presented by the chair, it is clear that this is an institution of excellence that will come in and close the gap that we have in terms of referrals. Currently, the Ministry of Health has an endless list which they are failing to send cancer patients. And many of them are dying waiting for their chance. But the visit, from the recommendations from the report, is showing that this is a hospital that is capacitated in terms of health personnel, in terms of equipment, and in terms of other resources. From the visit, we actually came to know that there's a number of Mozambicans, in fact, a big number of Mozambicans that are coming for treatment of cancer to Malawi. While Malawians, we are busy looking for forex to go to India. I think we need to take our opportunities, and we need to make use of our own hospital that Dr. Mpikanjira has helped us. We really need to appreciate this facility. It's a facility that some of the equipments that they were mentioning there, equipments that it's one of its kind in Africa. The other one was one of its equipment in the world, costing over $2 billion. I think we need to take these chances. Let's support the ministry, let's support the IBCC, let's give them that support so that we cut some of the costs that we spend outside of this country. The second visit to Central Medical Stores Blantyre also highlights the need to support CMST with space issues in Blantyre. The current buildings were built in the 60s, and you can imagine that there still is asbestos roofing, which in the health matters, it was banned, and people are working under such conditions. I think we need to come in and help the ministry and the Ministry of Finance so that they can at least engage some co-partners to co-finance and build a fit for purpose modern facility that will help, one, with space, that will also help with conditions to ensure that there's effective distribution of drugs. I think the poor distribution and the poor environments, that's one of the things that is also affecting us and pulling us backwards in terms of how safe delivery is delivered. I would also support the proposed digital tracking system as a critical step that will enable the CNCT systems to stay away from theft and corruption, and also help in the ending of proliferation of the falsified drugs, because they'll keep track of each drug that has been delivered to any health center, and they can be held accountable if there is any issues to do with resistance. The last comment that I would make is on PMRA. There's strong concerns about PMRA trying to make sure that the falsified drugs and the issue of theft is kept under check. But currently, the problems that we have is that they don't have a subsidiary regulations that support the bills, that will need to be supported by introduction of bills in the House. With the understanding from the reports that these bills have been stored and they're gathering dust somewhere. We need to act decisively as a House and work with the Minister of Health to push these bills so that they are passed actively, so that we are able to save our people from the reported resistances that are coming out from drugs that you can find in the market, the vendors are selling. In our constituencies, in lots of these markets, you'll find tetracycline and all other drugs. And we have so much news about resistance to drugs, new drugs that are found on the market. With these few remarks, Mr. Speaker, I support the report for adoption. Thank you.
Thank you, Doa Puzi. Yes, Leader?
Speaker, let me just yield for a minute or so to the Minister of Health.
Thank you so much, Leader. Minister of Health? You look beautiful, Minister of Health.
Thank you. Thank you, Mr. Speaker, sir. Mr. Speaker, sir, I would like to speak on the report that has been presented by the committee, the Health Committee. First of all, I would like to thank the Health Committee for a very good and clear report that has been shared in the House. Indeed, this report, as members have said, it's a timely report, especially now under the Nkulukuta government. Mr. Speaker, sir, I'm saying this because my ministry has taken note of the recommendations that have been made by the committee. Mr. Speaker, sir, I've noted that majority of the people that have spoken on the report have actually spoken on point of little knowledge on what is happening in the health sector. I would like to notify the House that my ministry already has a standing MOU with IBCC, the International Blantyre Cancer Center. And through this MOU, children and adults that have cancer and require radiotherapy, they are referred to International Blantyre Cancer Center. And this has taken place in our central hospitals, KCH, and also Queen Elizabeth Central Hospital. We are also aware that here in Lilongwe there is a cancer center. And what we are doing moving forward is to ensure that we also upscale the services so that International Blantyre Cancer Center can cater mostly for cancer patients that are in the southern region. Mr. Speaker, sir, it is sad to look at the members commenting, especially on central medical stores. I've taken note where a member who was a deputy minister within the Ministry of Health has stood up and passionately spoke about the status of central medical stores having various arrears. Mr. Speaker, sir, I would like to report to this House And it's very important that the House should take note of this. For the past 5 years, funding to district health offices has been very erratic. Sometimes central medical stores would go 3 months without funding. And also, Mr. Speaker, sir, my ministry, the Ministry of Health, we have inherited it at a very critical space when it was critically ill. Mr. Speaker, sir, the House would note that from April to September 2025, there was no single payment that the previous government made to central medical stores. As a result, central medical stores accrued arrears to various suppliers. As a result, central medical stores was almost at a collapse. It has taken this government, Mr. Speaker, sir, the coming in of this government to ensure that central medical stores, it is rising slowly and slowly to make sure that Malawians are benefiting from the drugs, from the medicines that the central medical stores supplies. Mr. Speaker, sir, the previous government transferred money that was meant for central medical stores to infrastructure, which is something that has never happened in this country. And the money for medicines, money for drugs, Mr. Speaker, sir, we ring-fence it because we understand the importance of drugs and medicines in the country. As I speak, my ministry has ring-fenced the money that we've earmarked for drugs and medicines, just to make sure that there is no gap at all when it comes to money that goes to central medical stores. This is very important that the House should know. When people are speaking about the areas that central medical stores have accrued and where it is coming from, it is very important that we appreciate the work that PMRA is doing, the medicines that have been recalled. It is because the authority is ensuring that whatever, and monitoring whatever that is happening in the space of medicines in the country. And they are able to detect very early of what is happening. And whenever there is an issue, they are able to send back, they are able to ban. This is the kind of PMRA that we want in this nation. And I must take advantage of this to applaud them and ask them to continue doing that for the safety of Malawians. I thought I should elaborate this. Thank you, Mr. Speaker.
Thank you, Minister of Health. Leader, you're rising.
Right Honorable Speaker, we now move to the report on Parliamentary Committee on Education, Science and Technology on field visits on education and early childhood development, ECD's priorities.
I thought, Leader, you should curtail the debate first.
Easy. You're right, Honorable Speaker. I beg to move that our debate on the report be curtailed to allow the mover to wind up. I beg to move.
Thank you very much, Leader. Honour members, there's a motion to curtail debate in order to allow the mover to wind up. Those of that opinion say aye. Those of the contrary view say no. The ayes have it and the motion is carried. Chair.
Thank you very much, Mr. Speaker, sir. And through you, I would like to thank all the members who have spoken on the report and in support of the report. And I would like to also thank the Minister of Health for clarifying on some of the issues that have been raised. But Mr. Speaker, sir, I would like to put it on record that our visit to IBCC revealed that the MOU that is standing is with St. Queen's Central Hospital. The service level agreement that the International Blantyre Cancer Center is pushing is the service level agreement with the Ministry of Health, not just central hospitals, but the entire Ministry of Health, or to put it in another way, the government, so that everyone, regardless where they're coming from, should have access to specialized medical care services. That's the service level agreement that they're pushing. On another note, Right Honourable Speaker, sir, we should put it also on record that the PMRA is failing to carry out its duties efficiently because they do not have regulations in place. It is high time, Right Honourable Mr. Speaker, sir, that regulations be passed, be brought into this House, debated and passed, because without these regulations, PMRA continues to work in an environment that does not favor them. To add also on this point, Right Honourable Speaker, sir, the antimicrobial resistance is a global issue, and Malawi is not spared. If we are not careful, we'll continue to lose our lives because of falsified and substandard drugs that we are consuming. We are consuming these drugs because the Malawi continues to have these substandard drugs because PMRA does not have personnel at the port of entry. So this noble responsibility is left with Malawi Revenue Authority. And these are people or officers that are not trained to test drugs. If there's that collaboration between the Ministry of Trade and the Ministry of Finance, this gap must be addressed. Because if we leave this gap open, believe you me, the deaths that we are talking about now, the 3,900 deaths related to antimicrobial resistance will continue to rise. I thought I should put this on record. Let's be careful and let's take this issue seriously. It is the issue to do with life. We cannot continue to politicize this issue. On the issue of central medical stores.
Welcome to MPUNGWE-PUNGWE YouTube channel. Subscribe for you to enjoy more of our videos anytime we upload.